2 decades ago, world leaders launched a bold new global health initiative at the World Economic Forum's annual meeting in Davos, Switzerland. Their goal was clear: ensure children in the world's poorest 74 countries had access to new and underused vaccines. In 2000, the Global Alliance for Vaccines and Immunizations, now known as Gavi, the Vaccine Alliance, was created for this purpose. The scope and complexity of Gavi's task were immense. For years leading up to its creation, the number of children in low-income countries who received the most basic, life-saving vaccines lagged far behind the rest of the world. That's in large part because these essential vaccines cost far more than the poorest countries could afford. Gavi reshaped and stabilized that market by encouraging manufacturers to lower vaccine prices in return for large-scale, long-term commitments to buy them. With these funds locked in, vaccine manufacturers agreed to sell in bulk to organizations like UNICEF, which are then able to provide the vaccines to eligible countries at much lower prices. By guaranteeing a market for their vaccines, Gavi made it possible for more children to be immunized. It also helped encourage more vaccine manufacturers to work with the organization. Since the year 2000, the number of affiliated manufacturers has grown. Many are based in lower or middle-income countries. The addition of these producers creates competition that drives prices down even further. Every country eligible for Gavi support must commit some funds to the program. Even the lowest income countries pay a small amount per vaccine, with the goal of building an annual domestic budget for immunization programs. As these countries develop economically and approach middle-income country status, they eventually transition out of Gavi support and pay incrementally more per dose per year until they're fully supporting their own vaccine programs. At the start of 2020, 15 countries have fully transitioned out of Gavi support. Gavi also helps countries strengthen their health systems so they can detect and respond to health challenges and deliver vaccines and other health interventions to all their children. In the 20 years since it was created, Gavi has built an impressive list of achievements. 760 million children immunized. 13 million lives saved. At least 433 vaccine introductions and campaigns. Health system strengthening activities in more than 60 countries. Under 5 mortality cut in half. Gavi now helps ensure vaccines are affordable and available to about half of all children globally. And every $1 spent on vaccines generates $54 in reduced healthcare costs, improved productivity, and broader social benefits. Roughly every 5 years, Gavi holds replenishment conferences where donor governments and private foundations pledge money to the cause. In June, Gavi will hold another pledging conference hosted by the United Kingdom in London. With $2 billion in resources already expected to be available for the next strategic period, the organization hopes to raise at least an additional $7.4 billion. Over the next 5 years, Gavi will help immunize an additional 300 million children and offer protection against 18 diseases. The United States has supported Gavi since the very beginning. As one of Gavi's original donors, its strong commitment not only supports Gavi's programs, but also sends a strong signal to other countries that they should commit to Gavi as well. Gavi's upcoming 5-year strategy is focused on overcoming the remaining and arguably most stubborn challenges to global immunization, including population growth, conflicts, humanitarian emergencies, and migration. That's why it's up to the international community, including the United States, to support Gavi's work and ensure all children get the vaccines they need to survive and thrive.